Mental health is one of the most misunderstood aspects of human well-being. It's not just about symptoms or diagnoses. It's about people, real people, navigating pain, confusion, isolation, and hope. And yet, for far too long, psychiatry has existed within a shadow, one cast by a painful history of mistreatment, misunderstanding, and stigma. Today, as we face a national mental health crisis and a critical shortage of psychiatric providers, that legacy still lingers. It shows up in the hesitation to seek help, the fear of being judged, and the deep distrust some people feel toward the system meant to support them. The therapeutic alliance, which is the relationship between provider and patient, is not just important, it's essential. It's the foundation of trust. It's how healing begins.
Well, I graduated from nursing school 51 years ago, discovered that I really liked psychiatry. Psychiatric mental health nurse practitioner. I've been prescribing medications for about 22 years now. I currently work at a mental health center, but I have had experience in 2 private practices and 3 mental health centers now, inpatient in a psychiatric hospital. I think a major misconception is that pills are the answer to everything. People need to develop coping skills. There's times in anyone's life where therapy is useful. Whatever you need to help get in touch with yourself, spirituality is a big help. The most important thing is respect. The patients always have to feel that you respect them. And the second thing I would say is listen, listen, listen. You know, the patient is often right. Not always, but often they are, and you really need to pay attention to what they say. And thirdly, never judge. Never judge. Understand that everyone is who they are for a reason. Time off is important. You really need a break, and it should be a total break where you're not tied to the phone or the computer. You do really need to get refreshed. Take care of yourself, you take care of everyone around you, so that if you're taking care of your mental health and you're not depressed and not anxious and you're functioning well, you make life much easier for your spouse, your children, your co-workers, anyone you come in contact with.
When we, as psychiatric providers, truly listen, when we honor the patient's voice, validate the patient's experience, and respect the patient's story, we begin to undo the damage of the past. We begin to restore what psychiatry should have always been: a space for care, collaboration, and compassion.
The one thing they always remembered was how you treated them. We're all equal.